A place of striking beauty and of punishing impossible terrain. Imagine being pregnant and having to travel through these mountains, crossing a raging river with a boat as a bridge. This is the only way now for women in many parts of Badakshan to get to a medical facility after US aid cuts shut down hundreds of clinics across Afghanistan. We're in Chaugani village. We've come to the clinic in the village which was closed down. It doesn't look like much, but it was a lifeline for thousands of people, not just in this village, but in 8 other villages as well. It was the only medical facility that they had access to. More than 400 such centres have closed down across Afghanistan after the US cut aid. The impact silent but staggering. The younger children in this family were born in the clinic. But 5-month-old Karima was born right here in this room. Her mother Medamo died shortly after delivery. This is Medamo's father, Ahmed Khan. He says they watched helplessly as she bled to death.
She was a piece of our hearts. It's very painful. If the clinic had been open, she might have survived. And even if she had died, we would not have had regrets knowing the doctors tried their best. America did this to us.
We go to another home in the village where we're told of another unrecorded death. 4 months ago, Bahisa's baby girl died soon after she was born. Her other children were delivered in the clinic. It was terrifying to give birth at home, Bahisa says.
In the clinic, we had a midwife, injections and medicines. At home, I had nothing to kill the pain. It was unbearable. I felt like life was leaving my body.
Baby Fakiha was named just before she was buried. In our quest to document more evidence of the impact of aid cuts, we drove to another district. When Abdul Wakil's wife went into labour 4 months ago, he spent more than he could afford to take her to the clinic in a car, not knowing it had closed. On the way back, his wife Shahnaz gave birth in the car. She and their baby both died. Abdul took us to Shahnaz's grave. It's where he brings his young children, 2-year-old Madina and her brother Faisal, when they ask about their mother.
We had a hard life, but we were living it together. I was always happy when I was with her. We couldn't live without each other. Now, I have no one.
Villagers gathered around us, telling us of more maternal deaths.
Daulat Begi Jawar. So, we've just been told that all of these 3 graves are of women who died in childbirth just a few months ago. Jawhar, Daulat Begi, Shahnaz.
There's no certainty the women would have survived in a clinic, but without it, they had no chance. Badakshan's main public hospital in its capital Faizabad is out of reach for too many in the province, and the journey so bumpy it could be dangerous. We were shown a horrific photo of a newborn baby whose neck snapped on the road to the hospital. But throngs of men desperate to save their families still try to make it here.
These are the scenes of chaos that we're witnessing at the gynecological ward of the Badakshan provincial hospital, because centres in district and remote areas have shut down, which means room after room here is really overwhelmed. And perhaps the most shocking thing that I've seen is look inside this room. These are all women who've suffered miscarriages. And right after that, they don't even have one bed on which they can recover and recuperate.
And even this hospital is facing sharp aid cuts, as much as 70% lower than what they had 3 years ago. Zura Shehwan told us This is the third time she suffered a miscarriage.
I was bleeding severely and didn't even have a place to sit. It was really hard. By the time a bed is free, a woman could die bleeding.
And at the current rate, maternal deaths recorded here are set to increase by as much as 50% this year. Newborn deaths have already surged by roughly a third in recent months. This baby, not named yet, but called Asma after her mother, suffered asphyxia and requires oxygen to breathe. The nurse told us she doesn't know if she'll make it. The baby's mother looks on. The doctors and nurses are exhausted, but no reinforcements are coming. 3 years ago, higher education, including medical studies, were banned for women by the Taliban government.
And in another crushing blow, late last year, the Supreme Leader also banned training for midwives and nurses. We're on our way to meet 2 students who were enrolled in courses when they were shut down. We have to meet them at a discreet location and they can't be identified for their own safety.
The women had started university, but when that was closed down, they told me they began nursing and midwife training because it was the only path left to get an education.
When the training was also banned, I became depressed. I was crying day and night, and I wasn't able to eat. It's a painful situation.
The Taliban spokesman in Afghanistan didn't agree to speak to us, so I questioned their Doha-based official, Suhail Shaheen.
You've said that humanitarian needs should not be politicized, but it is political decisions taken by your own leadership, which means that there are going to be no female doctors, midwives, nurses. You're denying the right to access health to half your population. Isn't that a bit hypocritical?
It is our internal issue. These are our issues. How to handle them, how to consider them, how to take decisions. But this is something our internal, of course, that is up to the leadership.
Afghanistan's women have endured a series of crushing blows. Their right to health and life itself is at risk. Yogatal Mai, BBC News, Badakshan.